Filler migration. It's a hot topic, especially on social media. There's a lot of myths about it. There's a lot of patients who are becoming nervous about getting fillers because of this buzz on social media that fillers migrate. So today I wanted to spend a couple of minutes deciphering and debunking some of the myths around filler migration and to convey to you what I think the truth is. Fillers are soft substances, so they're very liquidy actually, the hyaluronic acid fillers. And so imagine that you have a very confined space and you're putting a filler in. So if you try to jam too much filler or force too much filler into that confined space, what's the filler going to do? The filler is going to find a channel to move through because there's just not enough space for that amount of filler that you're trying to force into it. So then you're going to see spillover of filler into the adjacent tissue or the adjacent boundary or the area adjacent to where the filler was injected. This is not filler migrating onto itself. Somebody is forcing that migration of filler into the adjacent tissue. And that somebody is your injector. It's your inexperienced injector, or it's you plus your injector asking for too much filler in that confined space. So, to summarize it, I solve a lot of these problems for many patients. A very common area where people talk about filler migration is they put too much filler in the upper and lower lips, and the filler moves up to the border and above in the upper lip. So the filler is migrating, but the filler is not migrating through its own fault. It's migrating through the fault of your injector. They're injecting too much filler in a confined space, and that much filler does not belong there. So an example of what I just talked about in the lip is this. This patient came to me complaining of a lump here, as you can see this lump, and there's a little bit of a lumpiness right there. So she said that she'd never had this area injected, so technically the filler migrated. It's because the injector tried to put too much filler right in here, and this area could not handle that volume of filler. So the filler found a channel to travel through here and through there. This is not the fault of the filler. This is the fault of the injector. So fillers don't migrate because they have a tendency to migrate. It's because we force them to migrate by shoving too much filler in confined space with poor technique. Similarly, another area I see filler migration is in the cheeks, where you put too much filler in a confined space of the mid-cheek and the filler moves upward into the lower eyelids into the wrong plane, and then you get these bluish balls or bluish blebs in the eyelids. So again, the filler just didn't migrate because it just migrates. It migrated because your injector tried to force too much filler in your mid-cheeks. Here is an example of, again, filler migration in the eyelid, that lump that you see. Again, this filler didn't migrate because fillers just choose to migrate. No. This filler migrated because this patient had too much filler put in the cheek in the wrong plane, and the cheek simply could not handle that volume of filler, so it found a track or a channel and it traveled upwards to this area to form a lump. And so we actually dissolved this. But again, this proves the concept that there's no such a thing as intrinsic filler migration, but the migration has to do with poor injection technique by your doctor or by your injector. So the bottom line is that it's not the filler that's migrating, it's filler moving and finding channels because there's simply too much pressure in that confined space, and the filler needs to move around. The body pushes that filler through to a different space. So if you don't want weird filler, don't put too much filler in a confined space, don't force too much filler, and really, the bottom line is choose your injector carefully.